Hello, I'm Dr. Shereef Elnahal, Undersecretary for Health at the Department of Veterans Affairs. The sacred promise of caring for our veterans requires us all to work together to ensure quality health outcomes and continuity of care. VA has been working hard to create new and innovative ways to achieve that goal. I'm excited to share an important opportunity for all of you, our nation's health systems, to better serve veterans in your community and help us meet our national commitment to them. In October of 2023, 13 health systems signed on to VA's Veteran Interoperability Pledge, committing to developing and providing capabilities to accurately identify veterans when they seek care from providers in our communities, connect veterans with VA and community resources that promote health and health care, especially VA services that lower veterans' out-of-pocket expenses, and responsibly and reliably coordinate care for shared patients, including exchange of information about care requested and provided. The end state goal is seamless care for veterans and ensuring veterans getting care outside of VA understand what they are eligible for. For instance, in the end state, if a patient shows up to a community provider, that provider will first be able to determine if they are a veteran, which is already inherently valuable to their care. But then if the veteran is diagnosed with any of the presumptive conditions covered by VA, either through the PACT Act or otherwise, the provider can receive information on the VA claims process to pass on to the veteran. They will also be able to share the patient's medical record more seamlessly with the VA for coordination of care. Over the last year, VA has worked collaboratively with these systems and their electronic health record vendors to develop the Veteran Confirmation API. This new API returns whether a patient is a confirmed or not confirmed as a Title 38 veteran and provides visual indication of veteran status in staff workflows. Tufts was the first system to adopt the technology in January of 2024. Marshfield Clinic, Sanford Health, and Kaiser Permanente have since implemented the solution, and they're all putting it to work to better care for veterans in their systems. For instance, at Tufts, they have worked closely with the Boston VA Medical Center so that every time a veteran is identified through the API is admitted to their hospital, the VA clinical team is notified for possible follow-up and outreach, ensuring tighter care coordination and opportunities to connect veterans. And at Marshfield Clinic, they're leveraging the Veteran Confirmation API to connect veterans in their care to community resources, including VA resources. In short, these systems are demonstrating what is possible when we can more seamlessly share information about our shared patients, the nation's veterans. This industry collaboration is unprecedented. These health systems answered a call to action to improve veteran care and have leveraged their own resources to advance these new capabilities with no expectation for reimbursement. In a highly competitive market where every dollar counts, that is a significant action, but it doesn't stop there. Given the promise of this technology, two of the largest EHR vendors have now made the Veteran Confirmation API available to all of their customers. Stay tuned for Phase 2 of the pledge in April, when we will be starting to share more impactful interoperability initiatives designed to improve the veteran experience. In the meantime, I encourage you to reach out to your EHR representative to learn how to use the API or our pledge team at Veteran Interoperability Pledge at va.gov to learn more. Thank you for all you do to serve our nation's heroes.